All right, well, welcome back, everybody, to Pivot Point of View. I'm Destri Millsap, along with Becky Pearson, and this month we've had so many great guests. And if you've not been following along, go to our YouTube channel, go to Spotify, check out our past podcasts. We have had some incredible guests, and you don't want to miss those episodes. Last week we talked about knee pain and different knee injuries, and how to work around that. And today we're going to talk about taping. We're going to talk about different taping techniques, different types of taping, horses, people, all the things. So, Becky, what are some of the things that you would start with in the clinic, evaluating for to see if somebody needs tape or not?
Well, kind of depends on what they're there for. There, some of the diagnoses that I feel like can benefit from taping: shoulder pain, shoulder impingement, some shoulder instability, as well as knee pain, patellar tracking issues, um, plantar fasciitis. Those are some of my most common things that I tape for: sacroiliac pain or low back pain, instability. In the horses, I tape SI joints for SI stability. I tape stifles to help with patellar tracking for the stifles. I've used taping techniques to help with suspensory injuries. So there are a lot of benefits to taping for sure. How about you? What do you end up seeing a lot of diagnoses? What do you tape mostly?
Yeah. So I think sometimes what you do in the clinic and what we do in the training room, because we're taping for different types of things. So like we're taping kids to get out there for practice and play games and stuff like that. So a lot of the taping we do is more supportive versus some of the kinesio taping techniques you use. And a lot of people they have such a bad um, impression of kinesio tape, and it doesn't matter what type of tape you're using. It's only as good as the hands holding it and applying it. I mean, it really is. And you got to understand how it works and the structures that you're trying to tape. And that's the biggest thing is applying tape and thinking about the function and structure that you're trying to support. So we tape a lot of ankles. Obviously, we tape a ton of ankles, wrists, thumbs, shoulders, knees, all the different types of things with all the different types of tape. If we want more support, we're going to look at a thicker, heavier tape, or like we might use elasticon, we might use coverall, Leuco tape, things like that to provide a little more support. And then, of course, you have your 1.5-inch white tape that comes in a bunch of different varieties that we may use as well. And then for muscles, so there's a couple different ways you can tape the muscles. Obviously, you can kinesio tape it, or you can tape. You can use PowerFlex and Power Tape and do sort of like an anchor, an X tape job up the muscle and support it that way. And I found that for higher level activity, and especially if the injury is pretty significant, and obviously if they, are trying to compete and they're dealing with a hamstring strain or quad strain and calf or whatever it may be, that technique seems to work a little better than the kinesio tape in that situation, just because it's a little more supportive. But yeah, I mean, we do all sorts of we wrap hips, take hip flexors, groins, and all sorts of things.
Yeah, and I think, we should really kind of jump into the different types of tape, so like you talked about the white tape or traditional athletic tape, there's not a lot of give there, if any, probably zero. And so when we look at what we're going to tape and what we're trying to accomplish with that tape. So if we take, for example, taping an ankle after an ankle sprain, you're going to probably go with the traditional athletic tape with that. And almost basically, when you have a really good ankle taping job, it's almost like a cast, wouldn't you say? I mean, it's a really solid type support system to minimize the amount of instability at the ankle after being rolled. Would you agree?
Absolutely. And then, from there, depending on the severity of the injury and what you're trying to accomplish, then you can add like elasticon heel locks, elasticon stirrups, or like for the rodeo people, I like to use Leuko tape for stirrups and heel locks just because it's thinner, but it's very, very strong. And so it helps them get it inside their boot easier. So like especially like the goat tires that have bad ankles. And I like that Leuko tape for that extra support. And again, it allows them to get it inside their boot and have that extra support too.
That's a great idea. I hadn't thought about that. So do you use that directly on their skin or do you do that over like the white cover roll tape when you do
Yeah,
that?
so I'll start with, uh, I use pre-wrap, and sometimes people get along with the cover roll or the tough skin spray to help it stay a little better. And and so I'll use pre-wrap, white tape anchors, and then if I'm gonna use the Leuko tape, I might do a figure eight or a figure six. I might do a couple heel or a couple stirrups, and then I'll do the initial heel lock, and then probably some white tape heel locks over the top of that. So I just kind of build it into what I'm already doing, and then cover it up with white tape and call it good.
Yeah, well, I think that's a really good point. The Leuko tape is really, really rigid. I tell people it's kind of like duct tape for people. It's an awesome tape. It used to be kind of the go-to physical therapy tape before kinesio tape was invented. And so it if you need a ton of support, a ton of stability because that joint has, you've sprained some ligaments, things like that. You have a lot of instability there. The leukotape is great for that. We just had a conversation this week about somebody who fractured their collarbone, and what kind of a tape job would be helpful for that. And our recommendation was that we do the leukotape for that to give her some more stability because she fractured that bone. There's really not a cast for, collarbones. A lot of times they'll put you in a sling after you fracture your collarbone, but this gal wanted to be still functional. And so we're going to try out a leukotaping technique with her this weekend at an event to see if we can kind of unload that shoulder a little bit so it doesn't keep pulling down on that fractured collarbone. So there's a lot of times, when you're taping, it's just a matter of, like you said, just what are you trying to accomplish? And you just have to kind of roll with it and be creative, don't you think? I mean, it's not, you can follow a YouTube video, anybody can search it up on YouTube, but really you have to think about what you're trying to accomplish with that.
Absolutely. I mean, uh, it it seems like you make up more of this than you actually have. I mean, obviously you get a good foundation, and then your focus is okay. How does this need supported, and how can I make it work to where either it doesn't move or it moves a certain way or whatever. And especially like when you're inventing tape jobs on the fly, the first one may not be the best one, and so you rely on that feedback from them, like, okay, how's this feel? How did it feel whenever you did this, and then you can modify it and tweak it from there to be able to find the perfect tape job. And especially like so working the high school finals, we talked about the ACL girl and things like that, taping her ACL, making sure that we had a plan and that tape job felt right for her when she went to go do her deal. And the same deal has been, taping shoulders there as well. Might have a kid come in the perf before, and we'll do a tape job and have him go through his warm up and everything else and see how it feels and make sure that it's going to do the job that it needs to do. So, and again, there's so many different ways to do it. If you watch one person tape an ankle, you'll watch three others tape it three other ways. I mean, there's no really right or wrong way. It's all based on function and everybody's style.
Yeah. And what I like to do is I like to have people go through the motion. So let's say, for example, shoulder, my shoulder hurts when I raise my arm up. And so I have them raise their arm up before I tape them. and then I tape them, which I always do what I call a humeral head relocation, where I'm pulling the head of the humerus, which is the top of the arm bone. I pull that back and I have them kind of retract their shoulder, and then I take and I angle it across. And so I'm trying to get that head of that humerus to glide backwards and sit where it needs to be instead of being pulled forward by the tight muscles in the front of their shoulder, like your pecs and your bicep. And so I have them raise their arm before I tape them. I tape them, and then I have them raise their arm again. And most of the time, it takes away at least half of their shoulder pain. If it doesn't, then like you said, we just kind of readjust. We try it again. To me, if it doesn't take the pain away, then what am I doing it for? I mean, it depends. If it's instability, I may be taping just to keep it more stable. But if I'm trying to manage their pain with it, I'm definitely going to do a test and then tape and then retest and make sure that it's going to improve their pain. Same thing goes for knee pain. I usually try to have them do like a step up or something that's going to provoke that pain, tape them, and then we go do it again and see if we can get it to the best of their ability, to reduce their pain and improve their function.
I think you make a really good point there that gets overlooked, and for the fact of putting them in the correct position to tape them. And that goes for whether you're taping for support or kinesio taping or whatever. They got to be in the correct position in order for you to have more of an advantage with that tape. Because if you tape an ankle and you don't have it in a neutral position, and that's your goal is to keep it in neutral, you're not going to be as successful. However, if you're taping the ankle and you need their foot turned a certain way or whatever, like you're trying to take pressure off the foot or something like that, then yeah, you're going to have to change that position. Same deal with the shoulder. Like you said, you're going to have them retracted back because that's what you're trying to fix. And if you put them in that position when you start the tape job, you have a better chance of holding it there. So I think that's just a really good point that gets overlooked.
Yeah. And the other question I get a lot when I tape somebody is they're like, well, I can't have tape on all the time. So what's this really going to do? Is it like a Band-Aid? And what I like to tell people is the tape helps hold you where we need you to be until your muscles can get strong enough to hold you there without the tape. And so it isn't like you're going to have to tape yourself forever. Hopefully what we're doing with that tape is it's a prolonged stretch. So it's holding, like, let's say that kneecap where it needs to be until the tight muscles get stretched that are pulling it out of alignment, and then the weak muscles are getting stronger. And so it's kind of a means to an end. It's to complement the other things that we're doing. It's to complement the exercises. It's to complement the modalities. It's to complement, the soft tissue stretching and the myofascial stretching. And so it really is a complementary thing. It's not an, end all be all kind of a thing, but again, it just kind of complements the other therapeutic things that we're doing to help get you better.
Yeah, if you're not strengthening, even if you're somebody who has a chronic ankle that rolls or whatever, you still need to be strengthening that, restoring motion and function and whatever it is, the knee, the ankle, the shoulder, still need to be doing that, because you can tape an ankle every day for the rest of your life. But if you're not doing the exercises and the strengthening needed, that tape is maybe going to be less and less effective each time that you go out there, and you're not helping yourself out much.
Yeah, for sure. So it is not the only tool in our toolbox, I guess. It's just another complementary tool. One of the other things that happens a lot when we tape people that have chronic issues is some skin irritation. And so what I try to do is like a pre-wrap spray when I'm taping directly to the skin, especially with the kinesio tape. I find that it can irritate skin quite a bit. And that sometimes I don't have that with me, so we tape directly to the skin. And with that kinesio tape, like, you can leave it on for up to a week if your skin can tolerate it. But people will a lot of times get some itching under that tape, and so ways to minimize the itching is you can take it off. and B, Maalox. I've been told you could put Maalox on there. It kind of decreases, neutralizes that acid. Spray Benadryl. I've also heard that that can be helpful in reducing the allergic reaction to tape. Those are all things that can be done or that we've used in the clinic. How about you? Do you use some things to help minimize tape irritation?
Um, Sometimes, I mean, we do the best we can. Like if somebody's sensitive to the spray, we try not to spray them. We try to use pre-wrap, things like that, Power Flex, which sticks to itself. And so there's a few different options. If somebody has a adhesive issue, then we try to avoid that. What is the spray that you use for your kinesio tape, the pre-kinesio tape spray?
Just like a tough skin type of a spray.
Oh,
Mhm.
okay. All right. I
Yeah.
see.
Yep. So it just not only to help it adhere better, but also then, just providing a barrier so that the skin is a little more durable, to the taping. And the itchiness, some people are like, well, it's not that big of a deal that it itches, but then they do end up getting sores. And so then we don't want to have to manage an open wound on your shoulder or, on your hip or something like that. So it is really important to pay attention to that. And so we really have to be pretty cognizant of that as well. Now, the kinesio tape does not have latex in it, or at least like the rock tape doesn't. And that's the brand that we use in the clinic mostly because I feel like it has a better adhesive than some of the kinesio tape brands. And then you can even get different levels of stickiness of that. Like if you get the rock tape H2O, it's supposed to be a little better for water. And that's what I actually use on horses. Rock tape used to put out an equine version, but I can't get that anymore. So I just went to the rock tape H2O. And so that is a little bit stickier and helps, when you're taping to the hair of horses, that can get a little bit tricky. So you definitely need something that's going to be really sticky. And you can't put a ton of stretch on kinesio tape or rock tape when you're putting it on the horse with hair because it will just pull off if you stretch it too much.
Yeah, we use rock tape as well, and I just think it's the best one out there. And no, I mean, I have no affiliation with rock tape, but it's it's definitely the best one going. I feel like for keeping that on there, especially through you know the heat and everything else, people sweating. I still think that it's the best one going.
I agree. And honestly, I think it's fairly reasonably priced for being, as good as it is. It might even be cheaper than some of those initial ones that, like the Kinesio Gold and things like that. I think Rock Tape is actually even cheaper than those. And you can get it on Amazon or you can go right to the Rock Tape website. And yes, we're not endorsed by Rock Tape. Maybe we should look into that.
Yeah, equine website.
Yes, yes, for sure.
So
One of the other things that we use the rock tape or kinesio tape to do manage is swelling and edema and bruises. And so it's really cool to me to tape a bruise or a swollen area with the kinesio tape or rock tape. And if you want to do a little experiment on yourself the next time you have a bruise, tape only half of that bruise and leave the other half alone. And the next day, take that tape off. And the part of the bruise that's under the kinesio tape or the rock tape will be gone or much more diminished than the part of the bruise that was not taped. It is amazing to me, and I'll see if I can find some photos of people that we've taped bruises so you can see exactly where the kinesio tape was. It is, I think it's a testament to the function of that tape in that it's designed to gently like lift the skin to allow the lymphatic system to flush all that garbage out of there. And so it really does a great job. So if you get kicked, You're getting a hematoma under there. You can also use that tape to manage that as well. I think it's something that people should keep with them in their horse trailer, because how many times do we get kicked or bit or stepped on? Like, I really feel like kinesio tape in your horse trailer is like as important as vet wrap.
So, one of the things that we do help tape and that people are always like, oh, I got these shin splints and I just never know what to do for them and everything else. Well, there's a couple different ways that you can tape for shin splints. You can either do it directly, pulling the muscle back to the bone there, or you can fix the foot position and do an arch tape job. Or I like to use some figure sixes and correct the foot position, pull the arch up, and stabilize it more to the lower leg. So there's a couple different ways you can do that, and also plantar fasciitis. With that, you can do kinesio tape for that as well. What do you like to do for those things, Becky?
Yeah, so I use a combination. Like, if people come in and see me and they have a really acute case of plantar fasciitis, like it hurts those first few steps that they're walking in the morning, or they get a lot of like heel pain throughout the day, their arches feel super tired. One way that I help calm their foot down is I take the leukotape directly to the skin of the feet, because the skin on the feet is definitely more durable than skin anywhere else on your body. And so you can tape that, or use that brown tape right on the skin. And I build I call it a tape slipper for them. So I go from the heel to the ball of the big toe, and then I go from the heel to the ball of the little toe. And then I do basically then straps of tape perpendicular to those to help lift the arch up. And then I do strips from the side of their foot to their big toe, like from their heel to their big toe, and then along the little toe too. So it ends up being, like I said, kind of a tape slipper. And because that brown tape or leukotape doesn't really have any give to it, it rests that plantar fascia, because the fascia stretches every time you take a step. And that's how it became irritated in the first place, to create plantar fasciitis. And so if I can create a little bit of a rest period for that plantar fascia, it can give people a lot of relief very, very quickly. Like, they can walk out with less pain than they walked in, which, honestly, I mean, how many times do you have an inflamed area that people can be like almost healed in like one session? It is so cool to watch. And so I get their little tape slippers on them. I put them back in their shoes, and then they get sent, and then they come back a couple days later. Um, the other thing that I do with chronic plantar fasciitis people is I look at what kind of arch support do they have in their shoes, because again, we don't want that plantar fascia to be stretched beyond where it needs to be, with every step they take. And so I feel like getting adequate arch support for these people that have plantar fasciitis is so very important. And again, their skin's not really going to hold up to taping them every day. And so we got to find a better long-term solution as to how to control that. And so the leukotape is kind of my go-to. And then as we get it to calm down, then I progress to more of a rock tape or kinesio tape, just like a strip that gets anchored on the bottom of their foot and their arch and then goes up their leg. And so we kind of progress to less restrictive types of taping jobs as they get better.
Yeah, foot position is so important to everything, all the way up the chain, especially knee, hips, back, all that stuff. It can affect that, and if you have a muscle strain in your hip or whatever, there are ways to wrap that. One of the ways that people on the rodeo road usually wrap them is they'll use a rodeo wrap, and they'll wrap a groin or whatever with that, rather than you can wrap it with an ace wrap, like a 6-inch double ace wrap too. But the rodeo wrap has less give and is a little more support there, and easier to take on and off and all those things. So I like to use rodeo wraps.
Audio wrap. I don't even know what that is.
It's like a special. I don't really know how to describe it. I mean, it's like an ace wrap on steroids, basically, and it has Velcro on either end, and it goes on just like an ace wrap, but it's made out of a different type of material. I think Pro makes them, and I think that's who makes them. Anyway, and I'm not sure if that's the actual name of them or if that's just what people call them, but I think if you Google rodeo wrap, it's going to come up and show you exactly what you need, especially for, we know we have a ton of groin injuries in the industry, hip flexor strains, things like that. And for those, I think the rodeo wrap is the best thing going. What do you like to do for taping people with back pain?
Yeah, so that's a good point. So what I like to do after I've made sure that we get to pelvic neutral, I've found a lot of help for people if I run a strip of kinesio tape between their SI joints, especially if they're having sacral or pelvic instability. So if you find yourself going to the chiropractor all the time and your pelvis is always out, you need to strengthen so that your muscles hold you there and you aren't always out. But like, let's say you're going to be going to an event, you're going to barrel race, you're going to be doing something that you're like, oh, my back usually hurts after that. You can run a strip of tape just between your two SI joints, which is like where your little dimples are on the back of your back. And then like I also run strips of tape up and down the spine that will help with that as well.
That's right. That's right. And I think another thing that I think helps is doing the support strips across those long strips too. If you have a spot where um, the pain is pinpointed, sometimes I'll do an X right over the spot just to give it more support right in that area too.
Yeah. Yeah. I think it just kind of depends on, again, what are we trying to accomplish with it? Are we trying to stabilize? Are we trying to mobilize? And so that kind of changes a little bit of how we're going to tape that.
Anything else you can think of, or does that pretty much wrap it up?
You don't quit your day job as far as
No.
don't go into comedy yet. Yeah, I think we covered a lot of different taping things for sure. And if people do want to take a look at different horse taping techniques, I do have quite a few YouTube videos on our YouTube channel, and they can check that out. I think we have one on there for the SI joint pain, the suspensory pain, for swelling. So it'll give you an idea how to do that with your horse. You don't necessarily have to go through some big certification program. Now, if you plan on doing it to a lot of other people's horses, yeah, you probably want to do that. But if you're looking at doing some taping for your own horse, go ahead and refer to those techniques on there. And if you have other questions about how to, you have a specific thing that's going on with your horse and you want to know how to potentially tape it, I'd be happy to visit with people about that as well.
Sounds good. Yeah, if you guys have any questions about any tape jobs at all, whether it be supportive or kinesio tape for you or your horse, don't be afraid to give us a call. Find us on social media, reach out to us, and we'll be happy to help you out there. So
Yeah.
that's it for today. And thank you all for listening, and let your health be the pivot point to your success.